Welcome to another episode of the Bark Brigade podcast by Dogazilla magazine. Today we will talk about important topic and offer you a guide to help all families that owns a dog or other pet. But let's step away from the formalities for just a second, and get right into the reality of actually living with a dog.
Yeah.
Because if you are sitting there on the couch right now and your dog is right there next to you, you look at them and they give you that look back. And suddenly that tail just starts going.
Oh, yeah, the classic wag.
Right. And it might be this fluffy plume waving like a flag, or maybe a whip-like tail that's just thumping this rhythmic drum beat against your floorboards.
Or doing the full helicopter spin.
Exactly, the helicopter.
Yeah.
And if you have ever, stopped to actually watch the mechanics of that movement, you really have to wonder, what is actually inside there? I mean, is it just a tube of muscle and fluff? Are we literally just looking at a fleshy noodle?
A lot of people think that, yeah.
Right. Or is there something rigid and structural hidden underneath all that fur? Well, let me just save you a trip to Google right now. Today, we are taking a deep dive into a massive stack of sources.
Yeah, some really fascinating stuff.
We've got veterinary case studies, evolutionary biology papers, this massive 2019 anatomical scan of 120 different dogs, and some groundbreaking 2023 neurology research out of Helsinki.
Which is just incredible research, by the way.
It really is. And we are going to use all of this to answer that exact question about the fleshy noodle. And the answer is going to fundamentally change how you see every single wag your dog ever gives you. So what's the verdict?
The verdict is a resounding, definitive yes. Dogs absolutely have bones in their tails. I think there is this pervasive myth out there, especially among new pet owners, that the tail is just some sort of weird boneless appendage.
Like an octopus tentacle or something.
Yeah, exactly. Like a tentacle or a fleshy noodle. But the reality is far more fascinating. The tail is actually a highly complex, highly specialized structural extension of the dog's spine.
Wait, an extension of the spine? That sounds so serious.
It is. It is packed with dense bone, wired with incredibly sensitive nerves, and fed by a uniquely vulnerable blood supply. And it's driven by a surprisingly complex network of muscle groups. So once you understand the biological machinery operating under that fur, you truly start to view your dog's tail as a living, breathing instrument.
Okay, so to understand how to protect this instrument, which is, our ultimate mission today, we first need to really visualize what is actually happening inside it.
Right. Let's break down the unique anatomy of tailbones for total beginners.
Yeah, let's explain tail anatomy simply for new dog owners who are just curious about wags. If we were to pull up a high-resolution x-ray right now, what exactly are we looking at? Because my own spine is just this thick stack of bones. Is the tail just a miniaturized version of that?
Well, if you look at that x-ray, the very first thing you notice is that the tail is fundamentally the last chapter of the dog's backbone. It's made up of a series of small, distinct individual vertebrae.
Okay, so individual bones.
Right. In the veterinary and anatomical world, we call these the caudal vertebrae. And the most important thing to dispel right away is the idea that the tail is a single, solid, bendy rod of cartilage. It's not.
Oh, interesting. So it's not just one big bendy stick.
No, not at all. Describe the tail as a flexible chain of tiny bones and joints. It begins right at the base of the pelvis, right where the dog's rump ends, and it just extends outward into space.
I was trying to picture this while I was going through the research, and the best analogy I could come up with is like a specialized beaded necklace.
I like that.
Yeah, you have this string extending from the dog's rump, and the beads, which are the bones, right? They are relatively thick at the base, but they get smaller, thinner, and further apart as you move toward the tip.
That beaded necklace analogy is actually perfect for visualizing the gross anatomy. You have these individual bony segments. Scientifically, they're labeled sequentially as C1, C2, C3, and so on.
With the C standing for caudal.
Exactly, C for caudal.
Mm-hmm.
So C1 is that first thickest tailbone right at the base, anchoring the whole structure to the pelvis. From there, each individual bone connects to the next with a very small, intricate joint.
Okay, so they are jointed.
Right. And just like in our own human spines, between those bony joints, you have a spongy cartilaginous disc. This specific combination, the hard bone acting as a lever, the joint allowing movement, and the spongy disc absorbing the shock, is the brilliant evolutionary design that allows the tail to bend, twist, and wag.
It gives it that almost 360-degree range of motion. But as I read further into the anatomy, I noticed something that initially really confused me.
What was that?
Well, the bones at the base of the tail, like C1, C2, C3, they look somewhat like regular spine bones, but as you get down to, say, C15 or C20, they completely change shape.
Yeah, they do.
They lose all those little spiky protrusions that regular spine bones have. Why do the bones fundamentally change their architecture the further out they go?
That is a brilliant observation. And it brings us to a fascinating biological divergence between the main spine and the tail spine. If you think about the vertebrae in your neck or your back, they are large and complex because they have a massive responsibility.
Protecting the spinal cord, right.
Exactly. They form a hollow central canal to protect the spinal cord. And the spinal cord is the major superhighway of the central nervous system. But in a dog, that actual thick spinal cord stops well before the tail even begins.
Wait, really? It stops?
Yes, it terminates safely within the protected main body cavity of the dog.
I need to push back on that for a second. If the spinal cord stops inside the body, why does a tail injury cause a dog so much excruciating pain?
That's a great question.
And for that matter, I mean, if the spinal cord isn't there delivering the brain's messages, how does the tail even move?
It's a vital distinction to make. While the main, thick spinal cord stops, the nervous system doesn't just give up. At the end of the spinal cord, a complex network of smaller individual nerve branches continues outward.
Oh, okay. So it's like smaller roads off the highway.
Precisely. It's often called the cauda equina, or horse's tail. These delicate nerve branches exit from the last true vertebrae and travel down alongside and between the caudal vertebrae and the tail.
I see.
So the tailbones do not need a large, hollow protective canal because there is no thick cord to shield. Instead, they transform into simpler cylindrical blocks. Their primary job is no longer shielding a superhighway.
So they basically just act as structural anchor points.
Exactly. They anchor 18 different muscles. And those highly sensitive nerve branches I mentioned, they weave through and around these 18 muscles.
Oh, 18 muscles just in the tail.
Yes. So to answer your question about pain, when a tailbone is fractured or when a joint is severely dislocated, the structural collapse pinches, crushes, or severs those local nerve branches and tears the surrounding muscle tissue. The pain is localized but agonizing.
That sounds awful.
It is. However, the silver lining of this anatomy is that because the actual spinal cord isn't present in the tail, a traumatic tail injury, while terrible, rarely results in the kind of catastrophic back leg paralysis you might see with a mid-back injury.
Oh, wow. That is genuinely such a relief to know. So you are dealing with severe local pain, but not a paralyzed dog.
Right, the main neurological superhighway is safely upstream.
Okay, now I want to zoom in on the very tip of this beaded necklace for a second. The x-rays in the source material showed that the last few bones at the end of the tail look like completely different from the rest. They almost look like they are floating.
They essentially are floating. As you move down that flexible chain, getting further and further from the body, the bones become progressively smaller, thinner, and less complex.
Making sense.
By the time you reach the very tip of the tail, those last few caudal vertebrae are reduced to tiny, primitive nubs of bone. Some are barely the size of a pinky fingernail.
That's incredibly small.
Yeah, and they are so small that they often do not even have fully formed, functional, spongy discs between them anymore. They're just suspended within a tough capsule of tissue and skin at the end of the chain. They represent the absolute tapering end of the skeletal system.
So we have this flexible chain of bones varying from thick anchor blocks at the base to tiny floating nubs at the tip, all wrapped in 18 distinct muscles and wired with a network of local nerves.
You've got it perfectly.
So a natural question pops up, especially for all the new puppy owners listening right now. If I look at a tiny newborn golden retriever puppy, less than a week old, are they born with this complex machinery fully formed?
Well, yes and no.
Like, does that tiny little fuzzball already have 20 individual bones in its tail?
The blueprint is there, but the materials haven't cured yet. Puppies are born with their full, genetically predetermined set of tailbones. From day one, every single caudal vertebra they will ever have is present in that tiny tail.
But they're not hard bone yet.
Correct. They do not start out as the dense, hard, calcified bone we see in adult dogs. At birth and during those early developmental weeks, those caudal vertebrae are primarily composed of soft, pliable cartilage.
Oh, so that's why a puppy's tail feels so incredibly soft and almost rubbery when you hold it. It's not just the puppy fat. The skeleton itself is literally soft.
That is the exact reason. It is a biological necessity for the birthing process and for early mobility. But as that puppy grows, and as they start nursing and taking in calcium and phosphorus, a massive biological transformation occurs.
Detail how puppy tail bones harden from cartilage into bone during growth, because that sounds wild.
Over the first few months of life, through a process called ossification, that soft cartilage matrix is gradually replaced by dense bone tissue. It hardens from the inside out.
Which means the hardware is actively upgrading itself. But what about the software? How does the dog's brain actually tell those 18 individual muscles what to do with these hardening bones?
It's a marvel of neurological engineering.
Because coordinating 18 muscles to produce a smooth, sweeping wag seems incredibly complicated.
It really is. And to really understand it, we can look at some fantastic recent science. A 2023 study out of the University of Helsinki decided to look specifically at the neurology of the wag.
Okay, the Helsinki study.
Right. They utilized advanced imaging and neurological mapping to trace the signals that orchestrate tail movement. What they confirmed is that dogs possess a highly specialized, dedicated region in their brain known as the tail motor cortex.
A dedicated control room in the brain just for the tail. That really elevates the tail from being just an afterthought to being a primary appendage.
It absolutely does. When a dog experiences an emotion, say they see you grab the leash, that emotion triggers a response. Signals fire directly from this tail motor cortex.
And then explain how tail motor cortex signals in the brain enable tail movement, like the actual pathway.
Sure. The electrical impulses race down the main spinal cord, hit that transition point at the pelvis, and jump onto those smaller local nerve branches we discussed. These nerves act as high-speed messengers.
Passing the signal along.
Exactly. They deliver precise electrical shocks to specific combinations of those 18 different muscles. They tell the dorsal muscles on the top to contract to lift the tail, or the lateral muscles on the side to pull it left or right.
Here's where it gets really interesting to me, and it brings us back to the bones. It's exactly like a master puppeteer pulling strings.
That's a great way to put it.
Yeah, the spinal motor cortex is the puppeteer, the local nerves are the strings, and the 18 muscles are the mechanism creating the motion. But without the bones acting as structural anchor points, the muscles would just squish uselessly against each other.
Exactly.
If there were no bones, you'd just have a wet, pulsating sock instead of a wag. The bones provide the leverage.
Leverage is the absolute perfect word for it. In biomechanics, a muscle can only pull, it cannot push. When a muscle contracts, it shortens.
Right.
So in order for that shortening to create actual movement in space, the muscle needs to be firmly attached to a rigid lever. The caudal vertebrae are those levers.
Oh, that makes total sense.
When your dog wants to wag enthusiastically to the right, the brain sends a signal, the muscles on the right side of the tail contract, and they pull against the rigid bone, swinging the entire structure.
And if they're scared?
When they want to tuck their tail between their legs in fear, the ventral muscles underneath contract, pulling the bones tightly downward. It is a highly coordinated, flawlessly timed biomechanical symphony.
And the Helsinki researchers found some fascinating nuances in that brain-to-tail pathway, didn't they? I remember reading in the notes about a left-right bias, depending on what the dog is looking at.
Yes, that is one of the most remarkable findings in canine behavioral science. The researchers noted that the brain's hemispheres process different emotions, and this translates directly to the physical wag.
How so?
Well, when a dog sees something positive and approachable like their owner, the left hemisphere of the brain dominates. This causes the tail to wag with a slight bias to the right side of the dog's body.
Wait, really? A right-sided wag means happy?
Exactly. Conversely, when they see something that induces anxiety or fear like an unfamiliar dominant dog, the right hemisphere takes over and the tail wags with a bias to the left.
That is mind-blowing. The bones are literally acting as a billboard for which hemisphere of the dog's brain is currently firing.
It's amazing to watch once you know what to look for.
But since we are talking about the biology of the bone itself, I have to assume that just like any other bone in the body, this living tissue changes over time. Does a dog's tail change internally as they age into their senior years?
It changes significantly, and this is something pet owners really need to be aware of. The Helsinki study, alongside broader veterinary literature, highlights a crucial aging factor.
What happens?
As dogs enter their senior years, they experience a loss of bone density in their caudal vertebrae, just as they might in their hips or their spine. The bones become somewhat more porous. Furthermore, the cartilage in those tiny, intricate joints between the tail bones begins to degrade and thin out.
So they essentially get arthritis in their tail.
Exactly. The tail joints lose their fluid mobility. The result is that a senior dog's tail often becomes noticeably stiffer and less expressive. The wag might be slower, they might not be able to lift it as high, and it might hang at a lower, more neutral angle.
That makes sense.
And if you gently feel the tail of a very old dog and move it, you might even hear or feel a faint crackling or popping sensation.
I've actually felt that on an older rescue dog I had. It feels almost like tiny grains of sand grinding inside the joint.
In veterinary medicine, we call that crepitus. It is the physical sensation of bone rubbing against bone, or degraded cartilage grinding together, due to a loss of the protective synovial fluid in the joint.
Ugh, that sounds painful.
It is a clear indicator of localized arthritis. It is a powerful reminder that the tail is not just a static rod. It is a living, evolving structure that requires care throughout the dog's entire lifespan.
It really makes you appreciate those wildly enthusiastic, fluid puppy wags even more, knowing the complex neuroscience and fresh biomechanics making it happen.
Oh, definitely.
But, knowing how the brain pulls the strings and how the bones act as levers, we really have to look at how the tail itself varies. Because it varies wildly depending on the dog you have sitting next to you.
It really does. There's so much diversity.
If I look at a French bulldog and then I look at a Siberian husky, I am looking at two structurally different animals. Let's talk numbers. Explain how tailbone counts vary significantly across different dog breeds. How many bones are we actually talking about?
To get the definitive numbers on this, we can turn to a landmark 2019 study published in the anatomical journal Anatomia. This was a massive, highly detailed undertaking.
So they didn't just guess.
No, they didn't just guess. They performed high-resolution CT scans and detailed physical dissections on 120 different dogs representing 15 distinct breeds. They mapped, isolated, and counted every single tailbone.
Wow. And what did they find?
What they found was that the canine tail is incredibly diverse. The number of caudal vertebrae can range from as few as 5 to as many as 23.
Wait, 5 to 23. That is an absolutely massive structural range. If a human had that kind of variance in our spine, we'd be different species.
It is an extreme level of phenotypic variance, entirely driven by human selective breeding. Across all 120 dogs studied, the average was roughly 19.7 bones. But the extremes at either end of the bell curve are where it gets truly fascinating.
Okay, tell me about the extremes.
As you noted, French bulldogs, which are naturally short-tailed breeds, have very few. The CT scans revealed Frenchies with a mere 5 tiny caudal vertebrae.
Just 5.
On the complete opposite end of the spectrum, you have breeds like the Siberian Husky, known for that thick, long, expressive tail that curls over their back. The study confirmed they can possess up to a staggering 23 individual tailbones.
I have to push back on the husky for a second. 23 dense bones extending out from the pelvis. How does that not weigh the dog down?
It's a valid concern.
I mean, if you have a working sled dog running for hours, doesn't carrying an extra 24 bones drag on their stamina?
It is a great intuitive question, but evolutionary mechanics actually turn that weight into an asset. Explain how different tailbone counts impact a dog's balance and movement, right?
Yeah, exactly.
The bones in a husky's tail, while numerous, are optimized for strength-to-weight ratio. They're dense enough to provide structure, but light enough not to be a burden.
Okay.
More importantly, those 23 bones provide an elongated lever arm. When a husky is running at high speeds over snow and needs to make a sharp, sudden turn to follow a sled track, they throw that long, bony tail in the opposite direction of the turn.
Oh, like a counterbalance.
Exactly. The mass of those 23 bones acts precisely like a heavy rudder on a boat or the counterbalance on a tightrope walker's pole. It shifts their center of gravity instantly, preventing them from wiping out. So the weight isn't a burden. It is a vital aerodynamic tool.
That makes total sense when you put it in the context of physics. What about the classic family dogs we see every day? The golden retrievers, the beagles, the labs.
Breeds with those classic sweeping medium to long tails generally group around the higher end of the average. Golden retrievers, beagles, and even greyhounds typically present with 20 or more caudal vertebrae.
That's a lot of bones.
It is. The Anatomia study also picked up on some fascinating secondary patterns. For instance, they found a slight sexual dimorphism. Female dogs, on average, possess 1 fewer tailbone than their male counterparts of the same breed.
Huh, interesting.
They also confirmed a general physiological rule that larger, heavier dog breeds tend to have a higher total count of tailbones than toy or small breeds.
Okay, while we are talking about specific breeds, I have to ask about one that always confuses people. Rottweilers. People are so accustomed to seeing Rottweilers with those tiny, square little stubs. How many bones do they naturally have?
Rottweilers are a classic example of human perception being entirely skewed by cosmetic practices. Because the public is so used to seeing the stub, many people mistakenly believe Rottweilers carry a genetic mutation for a short tail.
But they don't.
Genetically and biologically, Rottweilers are a long-tailed breed. A natural, unaltered Rottweiler is born with a full, robust set of 18 to 22 caudal vertebrae.
So if I see a Rottweiler with a stub, that is entirely human intervention.
Yes, that dog was cosmetically docked as a puppy. Docking is a surgical procedure where the tail is amputated, usually without anesthesia when the puppy is just a few days old.
Yikes.
The procedure severs the muscle, the nerves, and cuts straight through the cartilage or developing bone, leaving just a short stub of perhaps 2 or 3 vertebrae. But their innate genetic blueprint, the DNA running through their cells, dictates a long, heavy, full tail.
So if the Rottweiler's stub is man-made, explain why some dog breeds have fewer tailbones than others naturally, like we mentioned the Frenchie only having 5. How did that happen biologically if no one is cutting it?
It all comes down to genetics, specifically naturally occurring mutations that humans have actively selected for over centuries of breeding. There is a specific genetic mutation, often located on what geneticists call the T-box gene, that disrupts the embryological development of the caudal vertebrae.
The T-box gene.
Okay. We see this mutation concentrated in breeds like the Old English Sheepdog, the Australian Shepherd, and the Pembroke Welsh Corgi. These dogs are literally born as natural bobtails. Their DNA instructs the body to stop building the tail after just 3 to 5 small vertebrae.
But wait, if we just establish that a husky uses its 23 bones as a high-speed rudder for balance, how does an Australian Shepherd or a Corgi manage without one?
It's a great puzzle.
They are herding dogs. They have to dodge and weave around livestock constantly. If they're missing their rudder, how do they not fall over?
What's fascinating here is how the canine body dynamically compensates for the lack of that skeletal structure. Because a natural bobtail breed lacks that rear bony rudder, they cannot shift their weight using a tail whip. Instead, they rely on entirely different body mechanics.
How do they compensate?
To compensate, natural bobtails have developed incredibly strong hind legs and highly intensive core muscles. During high-speed maneuvers, their rear end essentially sits much lower to the ground to artificially lower their center of gravity.
Oh, like a sports car hugging the road.
Exactly. They use brute force in their hindquarters to pivot, rather than relying on the aerodynamic counterbalance of a tail. They're just as agile as a long-tailed dog, but the physics and muscular demands of how they achieve that agility are completely different, all because of the number of bones in their tail.
So we've established what the tail is, this highly flexible, neurologically wired chain of vertebrae, and we've seen how human breeding has caused it to vary so drastically, from 3 bones in a Corgi to 23 in a husky. Now, let's zoom out even further.
Let's do it.
Let's try to understand why nature engineered this complex appendage in the first place. Discuss the evolutionary reasons why dogs need bones for communication and balance. Before humans started breeding corgis, why did evolution give the dog this bony extension? Let's talk about the ancestral blueprint.
To truly understand the why of the tail, we have to look back past the living room couch, past the domestication process, and look at the domestic dog's immediate evolutionary ancestor. The wolf, right? Evolutionary biologists are very clear on this point. The dense bone structure of the tail was not a biological accident or an aesthetic accessory. It was a strict necessity forged by the harsh, unforgiving demands of survival in the wild.
Right, because wolves aren't just trotting to the food bowl. They are running down prey over rough terrain.
Exactly. Wolves rely heavily on a rigid, bony tail for outright survival. As we touched on with the husky's biomechanics, when a wolf is chasing an elk or a rabbit at extreme speeds, dodging through dense forest trees and leaping over uneven rocky terrain, that tail acts as a vital counterbalance.
And it needs the bone for the weight.
Yes, it needs mass to work. Without those dense, sturdy caudal vertebrae to give the tail actual physical weight and momentum, a hunting wolf attempting a sharp turn at 30 miles an hour would tumble, roll, and lose its prey. From a purely mechanical, physical standpoint, survival in the wild dictated that the tail must have a solid, bony core.
I understand the wolf. But our living room dogs aren't exactly hunting elk for survival. I mean, the most intense high-speed maneuver my dog executes is sliding across the kitchen floor to intercept a piece of cheese that fell off the counter.
Right, low-stakes maneuvers.
That does not require a 20-bone aerodynamic rudder, so why keep the bones? Domestication has changed their ears, their snouts, their fur. Why didn't evolution just phase the tailbones out over the last 20,000 years?
Because the tail serves a second, equally critical evolutionary purpose that hasn't gone away: complex communication.
Mm.
The tail is the primary tool for social signaling and maintaining order within a pack hierarchy.
Oh, like dog language.
Exactly. And if you think about the physical mechanics required to send clear, unmistakable visual signals across a distance, you realize that soft tissue alone cannot do the job. If a wolf or your dog at the dog park needs to signal extreme dominance or high alertness, they need to lift that tail high above their back and hold it rigidly stiff. If they need to signal deep submission, fear, or appeasement, you need to pull it down and tuck it tightly and precisely against their abdomen.
And bringing it back to that wet sock analogy, a boneless, floppy tube of muscle could never achieve those distinct, rigid postures.
It would be physically impossible. A boneless tail could not be held erect to display dominance. It would just flop over. It couldn't tuck precisely. The caudal vertebrae provide the rigid framework that allows the muscles to lock the tail into these highly visible geometric shapes.
It's basically structural support for their language.
Exactly. Over millions of years, natural selection ensured that those tailbones remained strong, because an animal that cannot communicate its intentions effectively to its pack, an animal that cannot signal surrender or dominance, is an animal that gets into fatal fights. It does not survive to pass on its genes.
Wow.
So even though our domestic dogs don't need to hunt to survive, they absolutely still need to communicate with us and with other dogs. The bones remain because the conversation never stopped.
So what does this all mean for you, the listener, sitting there looking at your dog? It means every time your dog greets you at the door with a high, sweeping, confident wag, or every time they hear the vacuum cleaner turn on and immediately tuck their tail tightly between their legs in fear, you are not just seeing a cute behavioral quirk.
No, it's deep biology.
You are watching millions of years of evolutionary bone structure doing exactly what it was engineered to do. You are watching ancient wild wolf biology unfolding right there on your living room rug. It is a perfect, living, communicative system.
It is a perfect system, but it comes with a significant design flaw when placed in a modern human environment. Because the tail is a protruding, highly active, bony appendage that is constantly whipping around behind the dog, it is uniquely physically vulnerable to the outside world.
Oh, yeah. I can see that.
And that brings us to a critical part of our deep dive. What happens when this delicate structure is compromised?
I want to talk about exactly that, specifically regarding blood supply, because I read something in the 2021 veterinary study you provided that genuinely shocked me. Discuss the role of blood vessels in maintaining tailbone health, because I assumed a structure this active would have massive blood flow, but the reality is terrifying.
It is one of the most critical and least understood aspects of tail anatomy among pet owners. The 2021 veterinary study took a very microscopic look at the vascular system, the blood vessels that maintain the health of the tailbones.
What were they looking for?
They wanted to understand the common clinical problem. Why do injuries to the very tip of the tail so frequently result in total tissue death, a condition we call necrosis? To find out, they injected a highly visible dye into the main tail arteries of deceased dogs and mapped exactly where the blood flows.
And what did the dye show?
What they uncovered was a stark, almost frightening anatomical vulnerability.
And this vulnerability revolves around a medical concept called an end artery, right? Can you explain what an end artery is and why it makes the tail so fragile?
Let's compare it to the rest of the body. In most parts of your dog's body, or your own body, if a blood vessel gets blocked, crushed, or damaged, there is a built-in safety net. It's called a collateral vascular network.
Like a backup system.
Exactly. It essentially means there is a backup supply of smaller vessels that can route oxygen-rich blood around the blockage to keep the tissue alive. It's like having multiple detour routes when a highway is closed. But the dye study proved that the canine tail does not have this luxury.
No detours.
None. The last 3 to 5 caudal vertebrae at the very tip of the tail are fed by a single solitary vessel known as an end artery.
Which means there is absolutely zero backup blood supply. It is a one-way street with no detours. But why? Why would evolution leave a single end artery with no backup? That seems like a massive biological design flaw.
It does seem like a flaw, but it's a byproduct of the tapering anatomy. Because those final bones are so tiny, remember the size of pinky nail? There physically isn't room in the surrounding tissue capsule for a complex network of collateral vessels.
Right.
Space just tapers out.
That makes sense anatomically, even if it's dangerous.
Right, so it relies entirely on this one thin pipeline. And the consequences of this are severe. If that single end artery is crushed, say, the dog's tail tip gets slammed in a car door, the physical crush destroys the vessel. Instantly, all oxygen supply to those final bones and the surrounding skin is cut off.
And without oxygen, the tissue can't survive.
Exactly. Because there is no backup supply to take over, the bone cells and the skin cells begin to die within a matter of days. The tissue undergoes necrosis. It quite literally dies, loses all feeling, and turns a dark, leathery black.
That is horrific.
In almost all of these severe ischemic cases, the necrotic tissue cannot be saved or revived. It becomes a prime breeding ground for severe gangrenous infections that can travel back up the tail toward the spine. Therefore, the tip of the tail almost always requires surgical amputation by a veterinarian to save the rest of the dog.
That is genuinely terrifying. It highlights just how fragile the tip of this beaded necklace really is. So let's focus on vet insights regarding X-ray diagnostics for tail injuries. If a pet parent is worried that an injury has occurred, maybe a door closed on the tail or the dog caught it on a fence, how do vets actually diagnose these internal tail issues? I mean, they can't always just look at a fluffy tail and know if a bone is broken or if an artery is crushed.
This is where veterinary diagnostics become crucial. Because the structural core of the tail is fundamentally made of dense bone, radiographs X-rays are the absolute gold standard for diagnosis. A vet cannot just guess by palpating or feeling a thick muscular tail.
Right, you need to see inside.
Exactly. When a dog comes into the clinic presenting with tail trauma, the very first step is to get them into the radiology room. A broken caudal vertebra will show up distinctly on the X-ray film as a bright white opaque shape interrupted by a dark jagged crack or a noticeable space where the fracture has displaced the bone.
And the X-ray tells them exactly what kind of break it is, right?
Yes. It tells the vet precisely which specific bone is broken. Is it C3 near the base or C12 near the middle? It shows the severity of the displacement, whether the bone is shattered into fragments and whether the joint has been luxated or pulled apart. This radiographic map is what dictates the entire treatment plan.
The source material actually shared a real clinical case study that illustrates this diagnostic process perfectly. It was about a 5-year-old Labrador retriever named Max. Can we walk through exactly what happened to Max? Because as I was reading it, I realized this is a scenario that thousands of dog owners probably encounter every single year without realizing the danger.
Max's story is the textbook definition of everyday accidental tail trauma. Max was a very happy, highly energetic lab. And as anyone with a lab knows, that means he possessed a very powerful, heavy, wildly enthusiastic wag.
The lab wag is legendary.
It really is.
Yeah.
One afternoon, he was waiting for his dinner, wagging his tail furiously. He was standing too close to his wire crate, and he whipped his tail forcefully right into the rigid edge of the open metal kennel door.
Oh, no.
He let out a sharp yelp of pain and instantly stopped wagging. Within an hour, his owner noticed a dramatic change. Instead of his usual high, happy tail carriage, Max was holding his tail awkwardly sideways, and the bottom half of it looked completely limp and lifeless.
And the owner brought him into the clinic and asked the vet the very question we started this entire deep dive with. Do dogs actually have bones in their tail that can break from just hitting a door?
That was their exact question. They couldn't believe a wag could generate enough force to break a bone. The vet immediately performed an X-ray. When they put the film up on the light board, the image was undeniable.
What did it show?
Max had sustained a clean transverse fracture completely across his C7 vertebra, the 7th caudal bone down from the pelvic base. The force of the impact against the metal door had literally snapped the bony lever in half.
Just from hitting a door edge?
Yes. Because of the intense pain and because the structural anchor point was severed, the muscles below C7 had nothing to pull against. Max lost the ability to wag, and he was in so much pain he couldn't even lift his tail to defecate comfortably.
That sounds miserable. So what is the protocol for a break like that? You can't put a traditional plaster cast on a dog's tail, can you?
You can't put a heavy plaster cast on it because the weight would cause further damage to the base of the tail, and dogs tend to chew them off. For a clean, non-displaced break like Max's C7 fracture, the treatment is relatively straightforward but requires immense patience.
What do they do?
Max was fitted with a lightweight, soft splint, often made from specialized plastic or stiff foam, to keep the two halves of the C7 bone rigidly aligned. He was prescribed a course of strong anti-inflammatory drugs and pain medications to manage the swelling around those sensitive nerves.
I imagine the hardest part for the owner wasn't the medication, but keeping a happy lab from wagging for a month.
That is always the biggest challenge. Every time Max saw his owner, he wanted to wag, which risked re-breaking the healing bone. He had to be kept on strict crate rest and leash walks for 4 solid weeks while the bone cells slowly knitted the fracture back together. But he was lucky. The bone healed perfectly straight. The vet even gave the owner a copy of the X-ray as a souvenir of Max's fragile, bony tail.
A little morbid souvenir of the C7. But having seen the X-ray of Max the lab and understanding the physical forces involved, it's time we transition from the clinical veterinary side of things to the practical realities playing out in your own home right now.
It's so important to translate this into home care.
Exactly. How do these injuries actually happen on a daily basis, and what do they look like to the untrained eye? We mentioned the kennel door, but let's detail common household risks like slamming doors that often cause tail fractures. What else is causing these breaks?
The modern home is actually full of unexpected, highly dangerous hazards for a dog's tail. If we detail the most common household risks, the number one culprit, overwhelmingly, is slamming doors.
Why doors specifically?
Think about the physics involved. A dog is closely following you through a doorway. You step through, and without looking down, you swing the heavy wooden door shut. The tail gets caught directly in the door jamb. The leverage of the door hinge applies an immense, focused, crushing pressure straight onto those tiny, fragile caudal vertebrae and that vulnerable end artery. It is a recipe for instant fracture and necrosis.
Beyond doors, what else is causing these breaks?
Other very common indoor risks include heavy objects like books, boots, or heavy chew toys being accidentally dropped directly onto the tail. And quite simply, human error. People accidentally sitting down hard on a dog's tail when the dog is lying unseen on a sofa or a dark rug. For outdoor dogs, we see a high rate of tails getting caught in the gaps of chain-link fences or slammed in heavy wooden garden gates.
What about the injury we briefly touched on with Max, the idea that a dog can hurt itself just by wagging? I've heard the term happy tail. How can a dog break its own bones just by being happy? It seems counter-evolutionary.
It is a heartbreakingly ironic injury. There is a whole category of trauma known informally in veterinary circles as happy tail, limber tail, or cold tail. This typically occurs in large breeds with thick, heavy tails like labs or pit bulls.
What exactly happens?
They get so excited that they wag forcefully and repeatedly against a hard, unyielding surface like a sharp coffee table corner, an exposed brick wall, or the sides of a narrow hallway. The sheer blunt force trauma of their own happy wagging causes cumulative microtrauma. They can severely sprain the 18 muscles surrounding the bones, rupture the blood vessels causing internal bleeding, or in severe cases, the repetitive impact can cause a full hairline fracture in the bone itself.
It is crazy to think their own enthusiasm is a liability. If someone is listening to this right now and they are remembering that their dog yelped after a door shut earlier today, or they've noticed their dog has been thumping the hallway wall a little too hard, let's clearly summarize signs that indicate a dog may have a broken tailbone. What exactly are we looking for physically and behaviorally?
The clinical signs of a broken tailbone are usually quite distinct if you know what to look for. The absolute most obvious visual cue is a tail that is suddenly hanging straight down, like a lifeless wet noodle. It will look completely flaccid from the specific point of the break downwards.
Right, because as we established with the puppeteer analogy, if the bony lever is broken, the biological strings, the muscles and nerves, have absolutely nothing solid to pull against. The mechanism is broken.
Precisely. The tension is gone. Another major behavioral sign is a sudden, stubborn refusal to sit down. Think about the biomechanics of sitting. When a dog sits, they are putting direct pressure on the base of the tail and the pelvic floor, which mechanically pulls on the ligaments attached to the caudal vertebrae.
So sitting hurts them.
Yes. If there's a fracture anywhere in that chain, sitting sends a shockwave of intense pain right through the break. So an injured dog will hover awkwardly, stand constantly, or refuse to sit entirely.
Are there other visual changes to the tail itself besides just hanging there limply?
Yes. If you look closely, you can often see a visible kink, a sharp, unnatural angle in the tail where it should be a smooth curve. You will almost certainly feel localized heat and swelling around the fracture site as the body rushes fluid to the trauma. The dog will likely yelp, growl, or pull away sharply if you try to touch the area.
And what about licking?
Yes. You might also see them constantly licking or gently biting at the base of their tail, which is a canine self-soothing mechanism for deep pain.
What about internal issues? You mentioned earlier that the tail muscles are connected to the pelvic floor.
Yes, and this is a severe yet often overlooked sign of tail trauma, a sudden loss of bowel control. As we mapped out earlier, the complex muscles at the base of the tail are physically intertwined with the sphincter muscles that help hold the anus closed.
Wow, okay.
If the nerves or muscles at the base of the tail are severely traumatized or swollen from a fracture, it can temporarily disrupt that neurological control, leading to fecal incontinence indoors.
That is a massive list of red flags to watch out for. If a pet parent spots these signs, say the tail is limp and the dog won't sit, how should they handle the trauma in the immediate aftermath? Provide tips for handling a dog that recently sustained tail trauma before they can get to the clinic.
The absolute first non-negotiable rule is never, ever ignore a dangling tail. Do not assume it is just a muscle cramp that will pass. If it looks structurally out of place, it requires immediate veterinary attention. In the short term, in your living room, your main goal is to limit their movement and prevent further damage.
So keep them calm.
Do whatever you can to keep the dog extremely calm. Prevent them from getting excited and attempting a hard wag, which will grate the broken bone ends together. If you're comfortable doing so, and the dog permits it, you can use a very soft wrap like a human ACE bandage and wrap it very gently around the tail to provide some mild structural support.
Not too tight, though, right?
Exactly. It is crucial not to wrap it tightly because you do not want to compress that fragile end artery and cause necrosis.
And once you get to the vet, they take over the process.
Yes. The vet will perform the x-rays, establish the diagnosis, and prescribe the treatment. As we saw with Max, minor or hairline fractures generally heal well in 2 to 4 weeks with strict crate rest and prescribed anti-inflammatories. However, if it is a severe break, especially if the x-ray shows the bones are badly displaced or if there is suspected nerve damage, it may take months of rehabilitation.
In severe cases, do they do surgery?
In extreme cases, a veterinary surgeon may actually need to go in and use surgical pins and wire to hold the tiny tailbone straight, just like a surgeon would pin a broken arm in a human.
We've talked extensively about sudden violent trauma, but what about the slow creep of chronic pain? We know older dogs get stiff in the mornings. Can you offer expert advice on recognizing signs of chronic tail pain in dogs? What does an aging, painful tail look like?
Recognizing chronic pain requires a very observant owner. As dogs age, the thick cartilage in those small, intricate joints between the caudal vertebrae naturally wears down. This is the exact same process that causes osteoarthritis in human knees or fingers. Older dogs very frequently develop arthritis, specifically in their tails.
How does that manifest behaviorally?
Behaviorally, you might notice the tail has become generally stiff. It lacks that fluid, sweeping helicopter motion it had in their youth. They might carry it lower than usual.
And you mentioned feeling it earlier, the crepitus.
Yes. If you gently run your hand along an arthritic tail and move it slightly side to side, you will feel or hear that crepitus, that distinctive crackling, popping sound of bone rubbing lightly on bone where the cartilage is thinned out.
So
If you notice this constant stiffness, a reluctance to wag even when they are happy, or that crackling sound, it is a clear sign of chronic inflammatory pain. While you can't cure arthritis, a vet can prescribe joint supplements, specific canine NSAIDs, or laser therapy to manage the pain and return some quality of life to that appendage.
Okay, we've covered the deep anatomy, the evolutionary history, and the scary parts, the severe injuries, the necrosis, and the breaks. Now let's pivot and empower you, the listener, with actionable daily steps. You know the bones are there. Now we need to keep those caudal vertebrae safe and healthy.
Prevention is really the best medicine here.
Let's get into the comprehensive pet parent's guide to prevention and care. I want to start with a physical routine. Explain how to perform a weekly physical check on your dog's tail. What exactly should people be feeling for?
Instituting a weekly physical tail check is one of the best preventative habits a dog owner can develop. Pick a time once a week when your dog is completely relaxed, maybe lying next to you on the couch in the evening. Starting at the base near the pelvis, simply wrap your hand gently around the tail and run it slowly down the entire length to the tip.
Just feeling the bones.
Do this with a light massaging touch. What you are physically feeling for are any unusual hard bumps that could indicate a healing microfracture. You are feeling for sharp kinks in the alignment. Most importantly, watch your dog's face. You are looking for any tender spots that cause the dog to suddenly flinch, lick lips nervously, or look back at you.
And we also need to visually check the tip, right? Because of that end artery.
Exactly. When you reach the end of the tail, take a moment to visually inspect the very tip, separating the fur to look at the skin. Remember how vulnerable that area is to oxygen loss. Look closely for any dark discoloration, unnatural coldness, or leathery skin at the tip, which are the early warning signs of poor blood flow or impending necrosis.
This physical check is great for all adult dogs, but let's rewind and talk about the puppies again. Explain the importance of daily tail grooming for new puppy owners. Why is it so crucial when they are little and fuzzy?
For new puppy owners, daily tail grooming isn't just about making them look pretty. It is a foundational health practice. Remember the biology we discussed. A puppy's tail starts as highly pliable, soft cartilage and is actively undergoing the process of hardening into dense bone over their first few months.
Right, the ossification.
By integrating daily, gentle grooming habits early on, you accomplish two vital things. First, you psychologically desensitize the puppy to having their tail handled. If they get used to you touching it daily, future veterinary exams or injury treatments will be vastly less stressful for the dog.
So that's smart.
Second, daily brushing forces you to inspect the skin constantly. You need to check for tightly matted fur or hidden skin infections, particularly in the warm, dark crevices between the base of the tail and the dog's body.
And keeping that area clean during potty training is a big part of that, right?
It is a massive part. Keeping the tail and the surrounding rump area exceptionally clean during and after potty breaks is critical, especially for long-haired puppies. A bacterial skin infection that starts from trapped feces at the base of the tail can quickly multiply.
And that can affect the bone.
If left untreated, the bacteria can actually penetrate deep enough through the soft tissue to reach the developing vertebrae, causing a severe, deep-seated bone infection called osteomyelitis. So, rigorous daily grooming and hygiene ensures long-term structural health as that delicate cartilage safely hardens into strong adult bone.
Okay, we know how to check the dog's body. Now we need to check the environment they live in. Let's dog-proof the house. I want to provide practical advice for preventing common tail injuries at home. Based on the sources, let's list 3 essential steps for dog-proofing homes to protect tailbones, and then we will expand that list into 5 simple household changes to keep your dog's tail safe. What is step 1?
Step 1 requires looking at your home from your dog's perspective and evaluating your wag zone. You need to identify the areas where your dog gets the most excited, usually the front entryway when you come home or the living room where you play.
And what do we do in the wag zone?
You must proactively move low, heavy coffee tables, large ceramic decor, and anything with sharp, unyielding corners out of these specific high-traffic areas. If your dog's tail is constantly whacking against a sharp oak table edge every time the doorbell rings, they are at a very high risk for developing happy tail trauma and microfractures. Clear the runway.
Step 1. Clear the runway in the wag zone. Got it. What is step 2?
Step 2 is instituting strict household-wide door management. As we established, slamming doors are the undisputed #1 cause of crushing tail fractures and necrosis. You have to actively train yourself, your spouse, and especially your children to never, ever shut a door quickly or blindly when the dog is roaming nearby.
So make it a conscious habit.
It must become a habit. Always look down. Visually verify that the tip of the tail is completely clear of the jamb, and close the door deliberately, keeping your hand on the knob until it clicks.
That's just a good rule for life, honestly. Be aware of your surroundings. And I noticed in the sources that step 3 is about the dog's crate. I was trying to figure this one out, but it makes sense. If the crate has flimsy wire bars with wide gaps, a happy wag could easily thread through those bars, right?
You deduce the exact mechanism of injury. Step 3 relates directly to their safe space. If you crate train your dog, you must ensure you use a high-quality crate with smooth, thick, closely spaced bars or solid plastic walls.
No cheap wire ones.
Right. You must avoid cheap wire crates with sharp, unfinished edges or wide gaps. We see countless injuries where a dog is happily wagging inside the crate, the tail threads outward through a wide gap, and when the dog turns around abruptly, the tail gets caught and acts as a lever against the wire, snapping the bone.
Okay, so that is the essential 3. Move the sharp tables out of the wag zone, manage the doors with visual checks, and check the crate bars for wide gaps. Let's expand this into sharing 5 simple household changes to keep your dog's tail safe. We have the first 3. What are numbers 4 and 5 on your expert list?
Number 4 is a spatial requirement specifically targeted at the big breeds. If you have a large dog with a powerful, heavy wag like a Labrador, a Golden Retriever, a Great Dane, or a Husky, you must provide them with plenty of open, unobstructed floor space in their primary living area.
Just to give the tail room to swing.
Exactly. Do not crowd their specific living space with unnecessary clutter or tight furniture arrangements. The more open space they have to turn around, the less likely they are to repeatedly batter their tail against walls and furniture. You have to give the tail the physical room it needs to operate safely.
And number 5, we touched on it with the puppies, but it applies to all dogs, doesn't it?
Yes. Number 5 is strict, ongoing hygiene management. You must keep the tail area exceptionally clean, especially for long-haired or double-coated adult dogs. Feces, urine, or even wet mud trapped in the dense fur around the base of the tail can quickly alter the skin's pH and cause severe bacterial skin infections or hot spots.
Which can spread to the bone.
As we noted, those surface infections can rapidly spread inward, bypassing the muscle and reach the caudal vertebrae, causing bone infections that are incredibly difficult to cure. Good, consistent hygiene is a literal structural defense for the bones.
So we've done our absolute best to prevent it. We've cleared the tables, we watch the doors, we groom them. But dogs are dogs and accidents happen. Let's wrap up this practical guide by listing warning signs that suggest your dog needs an emergency vet visit. What are the flashing red lights that mean do not wait until tomorrow, go to the clinic right now?
The primary undeniable emergency sign is a tail that hangs completely limp and lifeless for more than 12 hours. Do not take a wait-and-see approach if a day goes by and they still cannot lift it. If it remains limp, go to the emergency clinic.
Okay, what else?
Other immediate visual red flags include any sudden, localized swelling, active bleeding that won't stop, or if you look at the tail and it's sitting at a visibly crooked, unnatural, sharp angle.
What about the necrosis risk we talked about, the end artery failure?
That is perhaps the most critical emergency. If you notice a foul, rotting smell coming from the tail, if there are open, oozing sores that appear suddenly, or if the skin at the tip begins to turn a dark, leathery black or gray, that is a dire medical emergency indicating active tissue death.
Because you only have a short window.
You have hours to get antibiotics and potentially surgical intervention started.
Yeah.
Furthermore, if your dog cries out in sharp, uncharacteristic pain when you gently touch the base of their tail, or if you hear loud, grinding, crackling sounds in an older arthritic dog accompanied by sudden signs of severe distress like panting and shaking, you need a veterinarian's intervention immediately.
So, to summarize all of this vast biological and practical information for you listening right now, the tail is not just a cute, fluffy accessory tacked onto the back of your dog. It is a living, breathing, incredibly complex extension of your dog's spine.
It truly is an engineering marvel.
It is packed with 18 distinct muscles, wired with vital nerve branches, and built upon a foundation of anywhere from 5 to 23 solid caudal vertebrae. It acts as an aerodynamic rudder to help them balance at high speeds. It acts as a highly visible billboard that allows them to communicate complex emotions, and because of its intricate and vulnerable design, it deserves immense respect and daily care from you.
It certainly does deserve that respect. Before we close this deep dive, I want to leave you with a final, somewhat philosophical thought to ponder.
I'm ready for it.
We've spent this entire time discussing the hard biology, how intricate, how engineered, and how purposeful this bony structure is. Now consider how much emotional weight we, as human beings, put on a dog's wag to understand their mood. We rely on that bone movement entirely to know if a dog is happy to see us, if they are anxious about a stranger, or if they are preparing to be aggressive. It is their primary voice.
We really do. We look at the tail before we even look at their eyes. It's their primary way of talking across the species barrier.
Exactly. So think about the profound implications of this. If a dog's tail is cosmetically docked for human aesthetic preferences, or if it is severely injured and loses its structural mobility, how much of their voice in the canine world is suddenly forcibly silenced?
Wow, that's a sad thought, but it's true.
Without those caudal vertebrae functioning properly as levers, they lose a massive part of their vocabulary. They cannot signal appeasement to an aggressive dog, and they cannot signal joy clearly. Understanding the biology of the bone completely changes how we should view their daily interactions. The next time you are standing at the local dog park, don't just watch the dogs running. Look closely at the tails. You will see that the bone structure we spent the last hour discussing is constantly at work negotiating space, signaling intentions, avoiding conflict, and speaking a rich, silent language that has been millions of years in the making.
That is such a powerful perspective to take with us. Thank you for listening, dear Brigadiers. And if you have any questions, visit the source article on Doggozilla magazine at doggozilla.com. That was all for this episode, and until the next time, bye to all listeners of the Bark Brigade podcast.